Good afternoon, good morning, good evening, colleagues, partners, and stakeholders from wherever you are joining us. It is a privilege to welcome you to this crucial session on addressing immediate bottlenecks in the procurement and supply chain management of commodities for Mpox testing and genomic surveillance. This is our session 2 on the genomic sequencing PSCM CoP, and we are very excited to be welcoming you to this session. And in this session, we are going to be discussing the effectiveness of the timely availability of diagnostics, reagents, as well as some of the genomic sequencing tools. We want to ensure that there is collaboration, innovation, as well as strategic action to ensure that there is supply chain resilience on the continent. So today we are going to engage in practical as well as solution-oriented discussions to try and identify concrete strategies that we can implement in our different countries so that we can overcome these obstacles. So with that, I will quickly take you through the agenda that we have today, and then we'll move straight to our presenters. So we'll do a quick recap of the near-term priority actions that we discussed in the last session, and then we'll get a country presentation from Uganda. Then we'll dive into some very exciting discussions that are going to stimulate us to come up with practical solutions with WHO, Africa CDC representation, as well as our industry partners represented on this call. Then we'll quickly then take a deeper dive into the next steps and ask our colleagues in Africa CDC to close up the session. So what are some of those near-term priorities that we discussed in the last COP, which we want to implement in the next 3 months? The first one is around ensuring that there is no delay in the delivery of the sequencing products for Mpox. So we are having this session to expedite addressing the immediate bottlenecks, hence the title of this session. We also discussed around advancing advocacy notes, as well as strengthening the procurement capacity, ensuring that there is price transparency and consistency across the region. We also discussed in the last session strengthening the procurement capacity, looking at transitioning to the utilization of Incoterms towards DDP. I think this is something very key, as well as developing guidance for selecting equipment and placement. We also spoke around the issues of developing essential diagnostic lists, ensuring that genomic sequencing products are also incorporated into these lists. And lastly, we spoke around capacity building, coming up with a proposal to establish capacity building programs for procurement and supply chain on the continent. So with that, I want to pause here and invite our colleagues from Uganda who are going to take us through their experience and share with us some of the fantastic work that they have been doing and how they've overcome some of the challenges that they were facing. So with this, help me welcome Dr. Isaac from Uganda CPHL, who is going to walk us through their Uganda country experience. Over to you, Dr. Isaac.
Yeah, greetings, colleagues. Edwin, sorry, Dr. Isaac has been called into an emergency meeting by the ministry. I'll be here to present on his behalf.
Oh, thank you, Alison. Please go ahead.
Confirm that you can see the screen.
Yes, Alison, we can see your screen. Please go ahead.
Yes, on behalf of Dr. Isaac, who is the Laboratory Director of the Central Public Health Lab, Uganda, I'll be walking you through this presentation briefly. For those of you who don't know where Uganda is, we are crossed by the equator. That alone, due to the hot climate and we are breeding ground for most of the zoonotic diseases. Year in, year out, we encounter at least one or two. Currently dealing with Mpox and cholera in the north. But in terms of our laboratory network, we run a tiered private and public laboratory and diagnostic network coordinated by a department within the ministry with two functions of stewardship management of lab systems, but also provision of specialized testing at the national reference labs, but also working with research labs. Most of you know UVRI, which is a regional center by WHO, but also supporting other activities and other in a One Health approach, working with both animal and agro labs, but in a tiered network. So we have three reference labs, the TB, the central, and the microbiology reference lab, supported with other systems. Just to go into the major of this day, Mpox testing, a snapshot of what's happening. Currently, we have over 2,000 cases confirmed with 13 deaths, affecting around, say, 84 districts. In terms of testing, we are averaging around 2 days and working towards improving. The country is trying to fast-track sequencing, both at the Central Public Health Lab, but also at UVRI, which are some of the major testing and sequencing centers. And just a snapshot of the samples sequenced at the center, we have at least over a number of 200 samples sequenced in those districts that so far have some confirmed cases, but we are working towards doing it real time. In terms of what the data that we have gotten from these, all samples are listed in our country at clade 1B. Although phylogenetically we see distinct 5 clusters that are moving in a temporal pattern, and we are trying to investigate how each cluster as it emerges, how does it come with pathogenicity, transmissibility, and we want to do something similar like we did in COVID, where we are tracking subvariants of the Omicron to see whether they pose a big risks, given that around the region, we are one of the countries that are reporting most deaths, apart from DRC. In terms of the negatives, we have had in the challenge of negatives, not only us, but also other member states. But we have tried to do some investigations, especially metagenomics. And we have realized actually majority of the samples we have are signaling chickenpox, which shows a co-saturation of this pathogen. And we have already submitted this to our officials, where we have guided that at least we should have a re-evaluation of the testing algorithm with not reporting the negatives, just as they are, but at least a chickenpox PCR is also done to give a report. Phylogenetically, we see for those that where we got good genomes, we are dealing with clade 5. It's predominantly been our clade 5 on the continent, but still within the samples we are seeing with the data we have, we are continuing to investigate 2 major clusters for the positives that we have for this varicella zoster virus, and we shall continue to monitor how it's moving, spreading, why it's moving at a speed that it does, and 2, why is it co-saturating with Mpox. Leaving alone that snapshot of what's happening, going to the challenges faced during supply chain management. The biggest has been customs clearance, because we can agree that as a country, we've been supported both by government, but also development partners, including SLM. But our major problem has been delayed customs clearance, these for majorly donor-funded supplies. And the other thing is a difficulty in accessing new suppliers during crises has been an issue. Also with the high costs during this period, has been a challenge on the local market getting the tests on ground. But also meeting the regulations, we have had challenges where you can get a kit, but then it's not yet approved, and WHO is working around the clock, Africa CDC. Until then, you don't know what to buy, so that's been a challenge. But also, as part coming from the lower middle income country, we have had insufficient of local funding, but there is increased advocacy. In terms of addressing these challenges, yes, we have cleared most of the goods that came from the donors, yes, implementing pre-clearance procedures, working closely with the customs teams, but we strongly and continue to strongly advise and recommend to our development partners that delivery to the lab doorsteps is very important because other labs may not, in other member states, may not have the systems that we have, clearing agents, and that I know would hamper a quick delivery of goods to the for service delivery. So we recommend that during procurements, they factor in door-to-door deliveries. Obviously, there is already established partners frameworks that we have with suppliers. So usually during crises, we call on to those to supply without looking for new within the system. It's much easier. Working around pooled fundings, ensuring that we comply. When we, for example, purchasing diagnostic kits for Mpox, and we looked at mainly at the WHO and Africa CDC approved list so that we really comply within. This would allow us not to reinvent the wheel of doing validations and approvals. But also we have done a great deal of leveraging the funding mechanisms available within the country, including the US CDC, Africa CDC AU, WHO SLM Global Fund, the ESC community, and the Korean government, and etc. So in terms of what I think we would recommend as best practices here, leveraging is very important, especially in this part of the world where budgets are not moved around as quick as possible. So if there are funding mechanisms that can easily support in terms of procurement, and we have seen that AU, Africa CDC, and WHO have been very, very, very significantly helpful here. Yeah, and still we recommend direct delivery to the laboratory because of the systems that differ in multiple countries. Even us with a system, we see it stretching because there's some cost to that, and sometimes you don't have a budget lying around to wait for a donation to do that, though we continue to salvage all the funding sources from government to clear, but still, if possible, a direct delivery to the laboratories is one way we can reduce turnaround time in the supply chain. Having pre-established contracts is very important. That way you don't have to reevaluate and just do call of orders. Having a diverse supplier base and not monopolizing it within a country has been very, very important. At least when one hikes the price, you have a run through. But also working with the local representatives of some of the companies has been a very, very significant strategy for us. It's very important that during emergencies like this, there is real-time inventory management. At least in every update, we should know how many swabs we have, how many PCR kits we have, and all the likes, the sequencing, to ensure that at least we never run short of the supplies, and having a clear communication with the laboratories, the procurement team, and the suppliers is very important. I think, Edwin, with this, I'll give back to you. If there are any questions, I can try to take them, but yeah, over to you. Thank you.
Great. Thank you so much, Alison, for taking us through some of the good work that you are doing in Uganda and sharing some best practices that you have implemented as you try to address the immediate bottlenecks in the procurement and supply chain in terms of the Mpox testing. So this is really great, and I'm sure colleagues on the call will have some very interesting questions coming through after the other presenters are done. So after this, I think it's time for us to get a global and regional view in terms of the guidance and recommendations for genomic sequencing commodity procurement and supply chain. So I will invite Biru Tesfaye from Africa CDC to give us a few remarks. Over to you, Biru.
Okay, thank you very much for having me. My name is Biru Tesfaye. It is my pleasure to be here in this community of practice webinar. I am from Africa CDC, a supply chain expert, and currently supporting the Mpox lab logistic pillar for the continental response. So for me, it will be a good platform since it is my first time. So I will learn a lot from countries and also from colleagues who attend this community of practice webinar regarding genomic procurement and supply chain management. So for the next session, I will be very ready, and also since I am new for this genomics supply chain, for the upcoming sessions, I will contribute more. So I have a few presentations regarding the ongoing logistics activity as far as Mpox logistics response concerned. So let me highlight the introduction, how Africa CDC and also WHO is doing for this Mpox outbreak response. So after the declaration, a continental response plan was prepared, and as a logistics pillar, we organized with different partners and try to have a comprehensive logistics pillar to provide a robust operation support. So far, we are supplying different commodities, including vaccine, diagnostics, and also IPC items. We're also supporting countries specifically for DRC, the in-country logistics support to transport items to last mile. So as far as logistics concerned, during this Mpox response, it was co-led by WHO and Africa CDC, different partners like UNICEF, IFRC, ACDC, WFP, and other partners were engaged for this response. And we have different functions. Laboratory pillar is one. We have also vaccine, IPC, case management, and in-country logistics wing to fast track the logistics response. So we try to have a regular meeting and track our supply chain activities. So specific to laboratory pillar, during this outbreak response, initially we do supplier identification or review of the existing suppliers for procurement and delivery of different test kits, sequencing items, and also cartilages. So the first activity was identification of suppliers. Then after the procurement, after the quantification of test kits is commenced, and we try to ship a significant amount of diagnostic kits to different countries. I will try to display the data in the next slide, and also we try to develop and issue guidance documents for diagnostic activities. So as far as Africa CDC concerned and Mpox response, for Mpox response, the following key achievements are presented here, specifically procurement and deliveries, and also capacity building activities. So for more than 80 member states, we try to deliver 41,000 qPCR kits and also near to 70,000 GeneXpert cartridges to 4 member states, and also training regarding laboratory workforce, sample collection, packaging, and handling transportation. Also, there is ongoing procurement for the newly affected countries like Sierra Leone, and also we are currently facilitating the delivery of more than 50,000 test kits to countries, including Uganda. So far, Africa CDC accomplished these achievements regarding the delivery of items. So we were facilitating the delivery, issuing different documents for facilitating the clearance. It was mentioned in the presentation from Uganda. We are also facing different challenges regarding timely clearance. But so far, we accomplished this number of items delivered to different countries which is affected by Mpox, and also as a preparedness option. So as we are discussing with supply chain, data visibility is one of the main concerns. So far, with partners, with the support of partners, we try to develop a dashboard to track the delivery, the procurement and delivery status of items to different countries, so which help us to track the visibility of logistics activities. So we try to have, the full data of what is delivered, which items is on transit, which items is already ready for shipment, and others, which help us to inform countries ahead for preparing to prepare different documents which help for timely custom clearance and other activities. So we have a dashboard. Currently, we are trying to expand from diagnostic to different items, including vaccine, IPC materials, and also items for cage management. So the system is still updating. So in the near future, we may have a comprehensive dashboard for the Mpox response. So challenge during this supply chain activity specific to Mpox, as mentioned by Uganda, we are still now facing delay in custom clearance, which costs additional, finance or budget, demurrage costs. So some countries are facing this challenge, and also Africa CDC is trying to support countries for this challenge. So so far during this response, we are suffering delay in custom clearance after the items are arrived, but Africa CDC providing donation certificates which help countries to have a priority during the custom clearance, but the challenge is still happening. The other one is the data, supply chain data. This will help us for informed decision making, but this is a challenge specifically for most affected countries like DRC. So we do our interaction review for this Mpox response, and we try to design a system to have such data for our supply chain decision, and limited resource to fulfill countries' demand. This is also another challenge. So as a next step, we are working with partners, we are working with the laboratory community to strengthening this outbreak response activity. So we continue the training, the capacity building activities, specifically on sample transportation. The procurement is ongoing to affected countries. So we'll follow this procurement in the timely delivery of items to countries. Also assist member states when they challenge for clearance. We also organize a webinar to have lesson learned during this response. So after 2 weeks, we'll have a logistics webinar, which we will invite countries like DRC, Rwanda to present their experience overall, not only for lab, for overall logistics. So different countries may take their experience and try to strengthen the system. So this is from my side. So if you have any questions specific to logistics, I will address. If it is beyond my scope, I will take a note and will come back. Thank you.
Wow, this is fantastic. Thank you so much, Biru, for taking us through that guidance and recommendations that you have as Africa CDC. It's quite impressive to see some of the next steps that you have suggested, and we really look forward to the implementation of these. To move us forward, we'll have the WHO perspectives on GS commodity procurement and supply chain management, their recommendations for countries that they have. So help me welcome Ismail Mahat Bashir from WHO, who's going to give us a quick insight into what WHO recommends. Over to you, Ismail.
Thank you very much, Edwin. Can you please confirm if you can hear me well and you can see my screen?
Yes, we can see your screen if you can put it in presentation mode, and we can hear you clearly.
Okay, thank you very much. Good morning, good afternoon, colleagues. My name is Ismail Mahat Bashir. I work with WHO as a technical officer for laboratory, and I've joined this community of practice. This is my first meeting. Unfortunately, I was not in a position to attend the first one. And so far, the discussion has been very encouraging, and it was good to see presentations from country as well as from Africa CDC. From WHO side, I just want to mention that we are working with all the partners in the field to improve the different pillars, but more so for us for the laboratory. And just to mention that we have colleagues who are on the ground at the regional level and also at the country levels who are coordinating activities and who are ensuring that at least that we work with partners to make sure we have access to diagnostics for Mpox. At the headquarter level, also we are involved in ensuring that at least we hasten the evaluation of the kits which are in the pipeline for pre-qualification as well as for emergency listing. So far, we are working with the teams in pre-qualification and emergency use listing for rapid antigen tests, which are in the pipeline. There are 6 of them which are undergoing process of evaluation. As you can see, their performance is quite encouraging, and we hope that they're going to be assessed and probably deployed in the field in the coming weeks once they are fully evaluated. Also, we are working also to evaluate point of care diagnostic tests, and these are the ones who match the expert machines which are deployed, so we'll be able to use in facilities which don't have a complete PCR lab. And these are around 6 of them as well, which are under evaluation, with 2 of them right now going assessment. And we are helping to make sure that we are checking the dossier of the producer, of the manufacturer, and at the same time doing external evaluations to make sure that these kits are approved and pre-qualified. Also, in regards to the commercial qPCR kits, currently we're working with Find to do a scoping review on all the available PCR kits. And after the scoping review, then we hope that we can come with a short list of 10 to 15 kits that can be evaluated in one of our collaborative central labs to assess the manufacturer's kind of like statistics in terms of limit of detection, sensitivities, and other diagnostic parameters. And once this is done and evaluated, then we'll be also be supporting in their pre-qualification and availability for countries to deploy. In regards specifically to this community of practice kind of meeting regarding the challenges related to procurement and supply chain management, especially by diagnostics and sequencing. I think that the challenges that were described quite clearly by colleagues in Uganda is what we also encounter in all other countries that we deal with. The first of them being like reliance on those proprietary reagents, which you don't have alternative but to go for them. The problem with that is that even though the performance and everything has been relied and approved, sometimes when you're doing procurement, the processes require that you're going to do a competitive process. And for you to do a competitive process, you have to have alternative in the market so that you can share their performance, their price, their deployability, and all that. So, but once you have limitations on the number of kits that you have, you will not be able to do that kind of competitive and get both the competitive price as well as all the advantages you get. So you have to take what is on the market. But the problem is even the approval for that, for you to go for a single kind of like a product out there, you need to get exceptional approval. And many times, even in agencies like WHO, who are in compliance with the normal procurement procedures, it's difficult to get such kind of approvals, and this delays the process. The other challenge, of course, is the lead time. As you can imagine, that most of the procurement of the items that we do, especially in resource limited setting, like where the Mpox outbreak is happening right now, those products are not available in the local market, as well as they are not available in the nearby market. Most of the things have to be shipped continentally, and during this process, it's a lot of time it takes, and we end up sometimes to cessation of testing because of this kind of challenges, and therefore this is a continuous challenge that we see in the field. The other major challenge we see is the short expiry dates of the diagnostics. You know that most of the kits, the best expiry dates you can get is probably 18 months. But if you look at the lead time as well as the processes, you will take at least 6 months to do those processes. And by the time you have completed your procurement process and the item arrives at the field or at the capital, you have exhausted around, say, quarter or more of the usable life of that items, and this also will at the end also have effect on your management of their supplies. The requirement of cold chain cannot be overemphasized. Most of the molecular tests as well as sequencing, they need a cold chain items, or the challenges of maintaining cold chain, especially in resource limited places, is quite huge. And if this is broken, also it could have been wastage of resources at the same time, wastage of time, and also could lead to problems of also limiting access to testing. The port clearance has been very well articulated, and we see this as Uganda put it, especially for donated items. As you expect that the port, they will ask you to get clearance from the minister for example, duty free, and to get that clearance from a finance minister, you can imagine how long it will take. It will eat more time on your processes. At the same time, it can also affect the cold chain, the demerit charges, and all other things that is associated. One of the other things we encounter is the last mile delivery. Some of the like partners and donors, when they deliver the items, they deliver at the central level to the Ministries of Health, for example. And for those items to leave the Central Ministry of Health stores to the last mile is a huge challenge. And for a donor, that's the point where they lose control of those items. So it is at the ministry store, and sometimes it takes quite some time. It needs pushing, following up, and a lot of challenges related to this. So those bureaucracies also have a lot of challenges. Biomedical engineering support in the field is limited, of course. Most of the companies who are working there, and they only deploy their kind of like approved biomedical engineers, and if that person is not in the country, it takes a lot of time to get that person into the country and probably used to install a machine or repair a machine. And this also has an impact on the availability of testing. Just a few recommendations, and this is not specific to supply chain management, just for strengthening lab response to health emergencies. I think the first and the foremost, I will say, is the preparedness and planning. And this is just to know that, we're dealing in a global health situation where diseases can strike anytime. You don't know what you are dealing with. There is issue of disease X. So preparing for this kind of emergencies is very important, meaning that you open your eyes and you think about what could happen the next time, and put the necessary steps in place in terms of, for example, submitting the right time for procurement of these kits to start. Also making sure that at least you have all the other stuff and everything, capacity building going on. The second,
Ismail, sorry to interrupt. You have 1 minute. If you can maybe just wrap up. Thank you.
Sure. This is my last slide. Thank you very much. Developing in-country capacity for diagnostics is also very important. Sometimes we say that we can use the resources from our next countries, but we have learned from COVID that international solidarity, when we are dealing with like kind of a disease which is multi-country, is not reliable. Therefore it's best to have in-country capacity developed. Tiered lab network also is very important. Sometimes countries, they try to develop capacities in say all the districts or provincial hospitals, and this somehow it leads to extraneous use of resources. At the same time, it's better to have labs which have been quality assured, and then set a system of sample transportation. Capacity building of staff, especially in administration and in procurement and forecasting, is very important. Improving access to innovative tools is something like is happening right now, especially in the deployment of genomics and metagenomic tools. I think that moving forward, countries also need to have this in their own settings so that they don't rely outside. And lastly, most of the things we see that countries only relying on the national public health laboratories, while you could have other capacities within the country. For example, research labs could be there, and academia labs also could perform some of the things that public health labs can do, meaning that if there's no capacity at the national level, then these institutions also can be brought on board. I'll stop here and thank you, and over to you.
Great. Thank you so much, Ismail, for sharing the global perspective from WHO. So with that, I think we have heard from the country. We now have the country perspective. We have heard from Africa CDC, a regional perspective. We have heard from WHO. It will not be right if we don't invite our colleagues from industry who are helping us co-create solutions. So I will invite at this moment, Alfred from QIAGEN. In 2 minutes, Alfred, to just share some insights that you have from industry. Over to you, Alfred.
Thank you, Edwin. Good afternoon, everybody. And thank you, Johnston, for inviting me into this really important, insightful call. So my name is Alfred Labeja. I'm the business manager for QIAGEN, looking after East Africa and SADC, supporting our distributors in the region. So for me, I think one key message that I would like to pass to the audience here is that since the start of 2023, we set out as QIAGEN to restructure our operations in Africa. And the reason why we have done this is to essentially eliminate some of the bottlenecks that the gentleman from Uganda mentioned around speed to delivery, costs, and providing local support to the customers or the users of our products. So I think the people here are very much aware of what QIAGEN are doing. So we are a leading provider of molecular technologies, providing sample to result. Essentially, we're looking at from sample collection to your extraction kits, which can come in the form of manual as well as automation when for busy labs, and onwards to the detection systems. So we got qPCR systems, and of recent we've launched digital PCR, which is hugely beneficial, especially in the public health lab for monitoring, for example, Mpox before even anybody knows, because of the level of detection that you can usually get from this technology. So lastly, I think of recent, we've successfully been working with ASLM, and going back to what I just mentioned, having local presence, in the East African countries, West African countries, SADC, and of recent as well in North Africa, has allowed our partners in these countries to deliver the kits to the labs in a timely manner. And even when, in some cases that we didn't have the stock in country, because of the close partnership that we've been having with SLM and the strong network of labs that we've had, we were able to push through. We understand what these emergencies are. The quicker we support the lab, the better the responses are. So, Edwin, I really don't have much to say. I would have loved to maybe go a little bit more into other things that we provide, especially like closed systems that can be deployed in a decentralized manner to tackle these outbreaks, at source. But I believe that this call will be a regular update call. So this would give us the opportunity to discuss more about what QIAGEN has to offer. Thank you so much.
Great. Thank you so much, Alfred. I'll turn it over quickly to Bridget from Illumina for some quick insights before we open it up to the questions and answers that we have from our participants. Bridget, in a minute or so. Okay, as Bridget is coming up, I will maybe just go straight to an open discussion. We have some questions that have been popping up on the chat box. Keep them coming. We really want to look at all those very important questions. The first question comes from Maeve, and it goes to Alison. And she says, are there specific commodities you have had issues with more than others in Uganda? Then secondly, would local manufacturing of any specific commodities make a difference in the Mpox response? Then the last question that we want to pose to you, Alison, is Uganda's response to Mpox has highlighted some bottlenecks in procurement. But of these challenges, we know that they are not new. Why do African health systems continue to repeat the same mistakes? And what concrete penalties should exist for institutions failing to act on the lessons learned? I think this is quite thought-provoking, but it's worth it. I will also take a question for Africa CDC and WHO so that you can also respond. It says global guidelines emphasize equity and resilience, but low resource settings, they still face a zero-sum choice. e.g. prioritizing diagnostics over PPE during this Mpox outbreak, how can your recommendations that you have shared with us today avoid being just aspirational and instead address these ugly trade-offs that countries are forced to make in real time? So that is to WHO and Africa CDC. So let's turn it over to Alison to respond, and then we will come to Africa CDC and WHO.
Yeah, thank you, Edwin. The first question is, did we face challenges with some kits than others? Yes, especially those that don't have local representation. Working with them becomes challenging, getting them in country. Those that do have local representation, it's been easy and know that the deliveries to the doorstep. The other question regarding whether local manufacturing could make a difference, this I think is a general question to AU. I know there is and SLM could come in here, and WHO. I know there are efforts to increase presence of African countries to manufacture local manufacturing, and I think the WHO has just highlighted on it. Having that built is going to allow us in times of crisis, as in times of global crisis, there is at least a solution we can run to that can support the AU member states. In terms of having it in every country, there has to be a discussion on wins and losses on how is that sustainable. Okay. But I believe if you have regional centers, or if we encourage global players like the ones that we have here in PC PAG, and having manufacturing plants within the continent would make sense. Like in other contexts they do. The other question I think is more of a general questions to the other member states and everyone here is, why is it a continued chronicle approach to things and not taking lessons? I think we believe that as much as we can do the same things, we are different, and that there are different systems. Some are better off, some at least infant stages. That's why they need support, and I think there has to be a targeted approach in a sense of how we look at this. Thank you, Edwin, back to you.
Great, thanks so much, Alison. Africa CDC.
Hello, can you hear me?
Yes, we can hear you. Go ahead, Bill.
I don't know, that question may address by WHO. Thank you very much. But from my side, I think I have a question regarding Alison who presented Uganda's experience. So one of the major concerns presented by myself, and also a challenge mentioned by the Uganda participant, is custom clearance, which affects most of our operations. So I need to know what specific support, other than changing the Incoterm, what specific support the country required to expedite this custom clearance. Is there any specific, for example, we are delivering test kits soon to Uganda, the same thing may happen. So what specific support they require? Because we have to, part of the solution for the country. So I need to hear from the focal person. Is there any support required from the partners like Africa CDC? For the mentioned concern, I think my colleague from WHO may address. Thank you.
Great. Ismail, if you can address that question.
Thank you very much, Edwin, and quite as you have said, thought-provoking question indeed. Personally, I can say is that at the WHO level, of course, you have seen during the time of COVID and when the countermeasures such as vaccines and other things were developed, there was a very strong call from the Director General on the need to have ensuring that equal access to all these medical countermeasures and making sure that we don't leave any region out. in regards to the availability of those countermeasures such as vaccines, diagnostics, etc. So this policy is universal in all the pillars, and we understand that we have the incident management system in place for Mpox response, and this includes most of the partners who are in this forum. And in that incident management system teams, we have a lead and we have a kind of like a council that makes sure that there's a universal access to vaccines, to the surveillance activities, to the lab diagnostics and everything, making sure that at least there will be no anyone who is going to be left behind in regards to this. So from WHO point of view, it's very clear from us as well as for other partners that we have challenges which are operational and others which we can have some work together and try to resolve. So, but there's generally a general understanding that we do every effort to make sure that the countermeasures we have, such as diagnostics, vaccines, and others, reach every part of the populations who are going through this outbreak. And the idea of the IMS system generally is to make sure that this is well catered for and planned for appropriately, to make sure at least there's a fairness, impartiality in the delivery of this urgent medical support for the people and the countries who are suffering. So generally, I can say that the IMST is well planned to cover this kind of challenges, and they're working together with the ministries to make sure that we address these challenges and operations to make sure we deliver the aid to the right people. Thank you, Anna.
Great, thanks a lot, Ismail. Just one last burning question to John Gatimu from Illumina, who is representing Illumina. So during the COVID-19 pandemic, the demand really surpassed supply and there were challenges. What measures have been put in place to ensure that these diagnostics for outbreaks like your Mpox won't follow that same profit-driven model, especially when these cases are concentrated in low revenue regions like Africa? John, can you respond to this in a minute? Kindly unmute yourself, John, so that you can speak.
Good. I was completely muted. Sorry. Yeah, thank you. Thank you for unmuting, Edwin. Thank you. Now, what are we doing, especially in terms of ensuring that the region, such as Africa, does not, as you say, follow the same model that was driven for the COVID? I think the entire industry is realizing that that we cannot continue to treat Africa like the same way that developed countries are treated. Most of these consumables, as my friend from WHO said, Ismail, are manufactured from somewhere, and the supply chain is lengthy, involving many partners. So we cannot be able to get the same solutions here in Africa at the same cost as they would in developed countries. So we are looking at that clearly and coming up with models and pricing models that are more friendlier to developing countries. And specifically, like at Illumina, we have the Global Health Equity Access Program, where qualified regional bodies and partners and procurement agencies can sign up and get solutions at a very good pricing as compared to other developed countries. Edwin.
Great. Thank you so much, John, for that. So this has been quite exciting, colleagues. I know we are running out of time. So in terms of moving towards the next steps, I want to put Trevor on the spot here. We've had calls on this webinar for collaboration, knowledge sharing, and in many other fora. What one action, Trevor, should every country represented on this COP commit to prove that this is not just but another talk show? We want this COP to be different. Trevor, one action step for every country.
Thanks very much, Edwin. And thanks to all the presenters who gave presentations today. I think we've started to get into the details of the supply chain challenges for Mpox genomic sequencing. And I think we're beginning to see maybe the emergence of potential solutions. I would say that probably if you ask what the one thing is, we have, I think genomic sequencing isn't necessarily on everyone's agenda when it comes to thinking about problems. And supply chain within genomic sequencing, even more so, is not on everyone's agenda. And so I think each country and the responsible entities, whether they be the labs, Ministry of Health, or various partners, needs to sort of look closely at what is holding up the genomic sequencing supplies. And very often it seems to be issues related to customs and clearance and those sort of steps that accompany the importation of the products into country. And that really seems to hold up things. And sometimes it's just, a document or a piece of paper that needs to be signed and moved from one office or one desk to the next. And that is something which I think needs a lot of attention. Perhaps sometimes, people believe that it's being done and someone's taking care of it, but meanwhile, it's sort of stalled somewhere. So I would say that developing a really good understanding and sensitivity of the issues related to the supply is very important, and particularly around this sort of importation and customs clearance process. That seems to be, from all the discussions that we've had as a community now, going back to our previous meeting and for some of the members here, even before that, that seems to be one of the key issues. And I would say in relation to that we have to keep in mind that we're hearing today and also previously that the shelf life of these products is extremely short. And so when you have a delay of a few weeks, even a few weeks in that importation process, it really has a very big impact on expiry of these kits. So when you have a 3 or 6 month expiry, having a delay of a month or 2 months can be catastrophic in terms of sort of wastage of supply. So the importation processes, I think, is one of the key areas to really focus on and to spend some time truly trying to understand. Thank you, Edwin, and back over to you.
Fantastic. Thank you so much, Trevor. And special thanks to our presenters, Alison, Biru, Ismail, Afraid, for sharing these very important thoughts that can then help us to develop actionable recommendations to strengthen the procurement efficiency to enhance Mpox genomic surveillance efforts on the continent. So there is a poll that has been put on your screens. If you can help us just rate our performance. With that, I want to invite Dr. Sarah Mwangi from Africa CDC in a minute to just give us some closing remarks. Over to you, Dr. Sarah.
Yeah, thank you very much, Edwin. And to the rest of the team, on behalf of the Africa CDC, I want to express our sincere gratitude to all the esteemed speakers and industry partners for their invaluable contributions. Today's discussions have been quite enlightening. We've had firsthand from Uganda about the critical challenges faced in procuring and managing the supply chain for Mpox commodities. And we've also gained insights from global and regional experts on best practices and recommendations for navigating these complexities. So I think the session has highlighted the importance of strong collaboration, data-driven decision-making, agile and adaptable supply chain, and investing in sustainable solutions. So I urge all of us to continue in this important dialogue and advocate for increased investment in strengthening health systems, especially in the areas of procurement and supply chain management. Thank you all for your active participation and insightful contributions. Do have a great rest of the day. Thank you.
Thank you very much.
Thank you.
Dr.
Thank
Mangu.
you.
Thank you, everyone. Looking forward to seeing you in the next CoP session. Have a great
Thank
day.
you.
Bye-bye.
Thank you.
Thank you. Bye-bye.